Okay, for today's lesson, we're going to learn about how to know your patient without knowing everything about your patient. So the thing is, let's admit it, there is no way for us to know everything about the patient because the amount of information is just too gigantic. EMR itself is really big, and we as a non-US IMG, when I first started, it's hard for us to operate the EMR, get in where's the tabs, where's the HNP, where's the vitals, where's the patient insurance information, where's the patient's power of attorney information. There's just no way for us to really know everything. On top of that, you still need to get some more information outside of the EMR. So, for example, like you got it from the nurses, you got it from the patient itself, you got it from the patient's family, you got it from the other consultants, you got it from the social worker. It just never ends. There is no way we know everything about the patient. But it's very important for us to know and master our patients because why? Well, that's one way for us to stand out during USCE. Why does the attending really happy when the intern or resident really know the patient? It's simple because it helps patient care. That's it. The focus of everything here is all about the patients. And in order for us to manage the patient well, we need information. And then if we got great information, high accurate information, then we can give the best decision possible to help patient. So that's why attending is very, very happy when the interns know the patient. And the intern should know the most about the patient because let's admit it, like attending has way more patients. The residents also have a lot of patients, but attending has way more patients. So the one that knows the patient really well should be the intern. Now, in your case, you are starting, you're probably doing observership. If you're lucky, you're probably doing a sub internship, and then you will play a role as an intern. That is the time where you can shine. You can really shine. You can really impress someone. You can really make the attending happy if you really know your patient. The problem is how. Well, the key to know your patient well is actually to know the important information. Not all information is important. You just need to know which one is important. The key lies to each specialty or field review of system. Meaning that each specialty has their own thing what they're looking for. That should make sense for you. For example, if I am in gastroenterology rotations, I couldn't care less what inhaler the patient is using, right? That's not an important information. I do care when the patient got the colonoscopy and endoscopy. If I'm in the cardiology, I couldn't really care less when the patient last have colonoscopy endoscopy, but I do care when was the last stress test or when was the last cardiac cath. So each specialty looking for their own thing, including when you're a hospitalist. If you play a role of hospitalist, there are things that are important for you, like the physical therapy notes become important. The case manager notes becomes important because that will affect your discharge plan, right? The cardiologist as a consultant does not really care much about the physical therapy information because they don't discharge the patients. So in order for you to know what's the important information, you need to know the each specialty review of system. I'm gonna give you example of my gastroenterology review of system. History. What are common GI complaints? Nausea, right? So in nausea, you're gonna ask about what's the trigger for nausea. Of course, with all of these questions, previous rule that I teach you about the onset, duration, and progression, aggravating factor, alleviating factor will apply. Okay, so I don't really put everything there, but you know, onset is the most important thing if you watch my previous video. So you still need to know the onset. But there are specific things here that the gastroenterology likes to know, like vomiting, not only the onset of vomiting or the duration of vomiting. They want to know if it's a bilious or bloody, right? If it's a hemoptysis. Area, how many times bowel movement a day, and how's the description? Is it loose or watery? And then there's associated things you're going to ask. Is there any recent travel? Do you have a sick contact? Do you eat extraordinary food? Is there any new medications? Because that can be a trigger for the diarrhea, right? Was that medication antibiotic? I specifically mentioned about the antibiotic because that is very, very common. And then rash, arthritis, eye pain, because we're going to relate that to inflammatory bowel disorder, right? And then ask if there's any fever or chills. For abdominal pain, you can use my rule, the Licora rule. But on top of that, we can specify the characteristic of the abdominal pain. Is it crampy, sharp, or achy, right? Intermittent or constant. And for constipation, that's another complaint that's common for the GI. Like you're gonna ask if it's hard stool, do you need to strain? Is there any sense of incomplete evacuation? Very important question because there could be a pelvic dyssynergia. Stool softeners, do they use stool softeners? Then unintentional weight loss, how many pounds in or kilos in how long period of time? And appetite, they have decreased appetite. Rectal bleeding, is it only toilet paper or actually it's on the stool itself? Is it like bright red or melena? If it's melena, you want to ask these four things. Do they take Pepto-Bismol, iron, blueberries, black licorice? So see, this is something that people tend to miss, right? If the patient describes dark stool and then the attending asks, do they take Pepto-Bismol? And you say you don't know, then you miss something, right? That's why I created this way. GERD, do they use PPI? And then dysphagia, is it solid, liquid, or both? Is it constant or intermittent? Is there any odinophagia? So these are the common complaints, right? And then past surgical history, the things that the GI cares is appendectomy, cholecystectomy, hysterectomy, or colon resection. Social is very standard. Family history is cancer from the inside because they can be genetically driven. And medications, of course, in general, we would care pretty much all the medications that the patient is taking, but especially is the one that's in the blood because it can cause bleeding. You really need to know if the patient is taking any NSAID that includes the over-the-counter medications like ibuprofen, right? Anticoagulation, Eliquis, Xarelto, Pradaxa, Lovenox, Heparin, all those. Okay, and then of course the last, endoscopy and colonoscopy. So these are the gastroenterology review of system that I have. I guarantee you, if you ask all these questions, that you follow it up, of course, with in addition of my mnemonic, onset, duration, progression, triggers, and then the aggravating, elevating factor for those symptoms, then you'll be solid. You will not really miss anything. Okay? You will master your patients when you know all of this information related to your patient. Of course, on top of this information, it's always recommended you know about the patient's living situations and who they live with. It kind of gives you the idea you know about the patient when you know their social situation. So I will share with you my each specialty review system. Just check your inbox in the next coming weeks. I promise I'll give it to you, and I'll give it to you for free. No need to pay anything for this. All right, so it's pretty short video today. I just want to give you this insight that you can really master your patient well if you know each specialty review of system. And of course, we tend to forget things. So having it printed out and then have this checklist and go through the checklist, very, very useful. Especially it can be done by you because you won't get that many patients. You have more time with the patients, and then you can try to ask all these things. You will be the one that know the patient the most. And that's it, the lesson for today. And I'll see you again in the next lesson.